Ask yourself this. When you have questions regarding your health, what do? Patients and their family members have been increasingly using the internet to answer these questions. But did you know that most websites on the internet which provide this information are inaccurate or medically irrelevant? Since most people read only the first few pages of the search results, researchers have analyzed around 1,300 websites with 13 web searches. Only 43.5% of the websites were in line with AAP recommendations. 28.1% of the websites were inaccurate and 24.4% were medically irrelevant. Moreover, there is also a widespread of misinformation and inaccurate advice on social media platforms. This is why I introduced MedIt, an app which is easy to maneuver with accurate medical advice and information reviewed by certified doctors. Now you may ask, why MedIt? It is easy to use, has efficient data transfer and tracking of records, and accurate medical advice and information. Now this gives us more questions, and I'll give you more answers. How is it easy to use? On this application, patients can create their account and fill in their health details, eating and sleeping patterns, medications, etc. Almost like a customizable health calculator, the AI technology used in the app recognizes various symptoms, patterns, and warning signs and gives the patient tips and advice to improve their health. How is it efficient to transfer data and keep records? Not only can patients use this app, but also hospitals and clinics. Various healthcare providers can create accounts on this app to which patients can link themselves to. Once a patient chooses their healthcare provider, all the medical data of the user is transferred simultaneously to the healthcare provider's database. Keeping track of records is an easy task as it is organized and saved to the account of the user and can be retrieved if the account gets deleted. Looking into the issue with privacy concerns, MedIt ensures that the user's personal info will not be shared. The only thing accessible to your healthcare providers will be your medications, symptoms, and some aspects of your lifestyle. How is it a source of accurate medical information and advice? Certified medical staff review diagnosis by checking the symptoms and medical history of patient. Consultations with a doctor are recommended if the AI technology is unsure instead of giving wrong diagnosis and advice. AI works through assessing your symptoms, lifestyle, and medical history instead of basing advice on one search about a symptom, and information on your feed is properly checked before publishing. So how is this a blue ocean idea according to the 6-patch framework? It looks across strategic groups within an industry. It looks across the complementary product and service offerings. It rethinks the functional emotional orientation of its industry and participates in shaping external trends over time. According to the ERRC grid and the 4 actions framework, we eliminate inaccurate medical advice and information, we raise health awareness and convenience, we reduce the cost and late diagnosis, and we create an easy-to-maneuver app, easy data transfer and tracking of medical records, and personalization and customization. As we can see in the strategy canvas, we offer a value curve in our blue ocean strategic move as compared to the current industry value. The health and fitness app industry is one that is rapidly growing and has a global market size of $1.1 billion and is expected to reach a size of $120.37 billion by 2030. The industry has a CAGR rate of 23%, and one of the key drivers of growth will be the growing adoption of wearable devices. The current industry focuses mainly on product offerings like nutrition, diet, exercise, and yoga. Since the focus of MedIt is entirely different, the competition becomes irrelevant. Now our current market is of people who like to use fitness and health apps. Our soon-to-be non-customers are of people looking for apps like this or are looking for better options. People who don't have time to take care of their health make up of our refusing customers, and our unexplored market is of people who don't use fitness and health apps or feel that they are healthy. According to Forbes, the United States led the world in fitness and health app installs in 2020 with 146% more app downloads than India and almost 300% more than Brazil or Russia. 64% of us are spending more time in fitness apps than we were in 2019. The COVID-19 pandemic has raised the usage of these apps. We offer a subscription plan of $15 a month and $165 a year for patients and consumers, and $20 a month and $215 a year for healthcare providers. Following the Pioneer Migrator Settler map, MedIt values improvements and values innovation. To a healthier future, MedIt.